My name is Corinne Gentry, and today we're here to talk about GVD. Well, you may ask, what is GVD? Well, it is gastric dilation and volvulus, commonly known as bloat. It is a severe and life-threatening pathological condition that affects dogs, particularly large and deep-chested breeds mostly. It occurs when the stomach fills with gas or food and expands rapidly, and then twists on its axis, leading to obstruction of blood flow to and from the stomach. The results are from causing tissue damage, shock, organ failure, and possibly death if not promptly treated. GVD has a severe risk factors that have been identified, most likely in pure breed dogs over the age of 3, either large or giant breeds weighing more than 30 kg. Foreign body ingestions, diarrhea, and grass consumption can also increase the likelihood of GVD. GVD is an acute condition, meaning it develops suddenly and progresses rapidly. This is evident of the sudden onset of symptoms and the severe distress experienced by the affected dog. Anatomically, the stomach is located in the abdominal cavity, just behind the diaphragm and the liver. It is closely associated with other organs such as the spleen, liver, pancreas, and intestines. When bloating occurs, the stomach expands, putting pressure on the adjacent structures and potentially causing further complications. GVD presents in a variety of clinical signs and symptoms, often progressing rapidly in severity. Such signs and symptoms are restlessness and pacing, abdominal distension, an unproductive vomiting or retching, excessive drooling, rapid breathing, pale gums and weakness. It can also cause the pet to collapse, have abdominal pain, jaundice, or shock. Discussing GVD is important due to its severity and potential fatality. It is a relatively common condition, especially in certain breeds, and can lead to death within hours if untreated. Additionally, GVD is often misunderstood and has misconceptions about its causes and prevention. Proper awareness and understanding how pet owners can recognize these signs early and seek immediate medical care. Here are a couple of the diagnostic tests we utilize to confirm the presence of GVD. Lots of the diagnostic tests include radiograph or ultrasound. We can use those to identify the stomach and the organs around it to actually see the torsion of the stomach twist, as well as a physical examination can help us just to see how the stomach is bloated out, has that distension. With the stomach distension, usually the pet will have its abdomen will be very rigid, so that will be one of our first clinical signs that we see. There are additional things like blood work, abdominal centesis, or the laparoscopy, where we can use those diagnostic tools to visualize or to see if there are certain levels like low protein, or if there are certain things like the metabolic acidosis that we could see on blood work as well. There are preventions towards GVD, feeding practices, including where you divide your dog's daily meal into smaller portions more frequently than one large meal, so that way all the food is not sitting on the stomach at one time, as well as dietary considerations, exercise management, stress reduction, regular veterinary checks, also bloat risk assessments. When it comes to treating GVD, some of the things that we first worry about immediately is stabilization. With stabilization, we immediately assess the pet upon presentation with the veterinarian. From there, we look at things like if this pet is eligible for surgical intervention, meaning that we go into emergency surgery to treat the GVD, meaning that we then cut the pet open and we will visualize the stomach and untorsion it. And for future occurrences, so this doesn't happen, we would do something called a gastropexy, which is where we actually take the stomach in its normal position in the stomach and we would tack it to the abdominal wall. So in the future, this will help prevent these episodes of GVD to the best of its ability. Post-operative care is also extremely important when you have such a critical surgery. We always monitor things like vital signs, fluid balance, and pain management, and make sure that the organ function is properly manage just to make sure that we have proper blood flow so all of those organs can continue to work the proper way. Here are some mildly graphic photos of what you can see where the stomach is actually bloated. And here are my citations. Thank you so much.